Welcome back to San Antonio Living. You know, the summer is when you want to look your absolute best, and there is still time to do that. Dr. Shah is joining us with Dr. Shah Plastic Surgery. It's so good to see you.
Good morning,
Thanks
Shelley.
for coming.
Thanks for having me.
You know, women my age, women younger than me, women older than me, and even men. We're all wondering about the latest things going on so that we can look our very best.
Absolutely.
Because you always have to put your best face forward.
Absolutely. I think that's very true in the 21st century.
Yeah, you guys are on the north side. You're right off of Stone Oak, and we've got a picture of the office where you are so people can come and find you. It's a fabulous location, beautiful inside, and very comfortable. And of course, you want to make your patients feel comfortable.
It's a Class 1 medical office, but we're trying to create a more comfortable spa atmosphere while still providing first-class medical services.
So that means that people can have a lot of treatments done without having to go to a surgery center or something like that.
So there's a lot we can do in the office. There are some things we probably can't do in the office, so we do a little bit of both.
All right, let's start with the entry level.
Okay.
Botox, right?
Yes,
That's the first thing that people ask for when they start to see those wrinkles.
Yes.
We've got a couple of pictures to share with the viewers this morning to show you how simple it is to fix. That's the grumpy line, I call it.
We call it the infamous number 11 sign.
Yes,
so,
see, number 11, you can see it right there.
So it's very amenable to Botox, fortunately.
You just put some in, you're good to go, you look much happier.
Yes, it does give a nice, refreshed appearance. I think the technique is critical. We can't cookie-cutter Botox. We have to tailor it to the individual patient. So the crow's feet here, very effective.
That's so important. You do need to go see someone reputable when you get your Botox, because if you put it in the wrong place, you'll end up with a look that you don't want.
Yes, and unfortunately, this isn't something we can cover with a pair of jeans or throw a blouse on. It's a very prominent, area.
And we've been doing Botox long enough now that people can tell when you've had Botox in the wrong spot. There's a very telltale look. Let's talk about step 2 is filler. Where can you put filler these days?
Filler technology has advanced a lot, Shelley. So now the filler is preloaded with anesthetic, so the discomfort dramatically reduced. Here we put this filler underneath the eye, so with time there's a descent of the cheek, unmasking of the orbital rim, so we can augment that with filler just for a nice rejuvenation effect.
Okay, that is a huge difference. Now, what if you're going past the injections and now it's time to maybe have some surgery?
Yes.
A lot of people start to notice the age around the eyes and the eyelids, and you do eyelid surgery.
Yes, we do upper eyelids, lower eyelids, we do the brow. My practice specializes in cosmetic surgery of the face only.
Okay.
So here, very sweet lady here. The brow is collapsed a little bit, so we clean up the brow, upper eyelids. So just giving her a very nice, refreshed appearance.
And you know, as you get older, things just start to drag and droop just a little bit.
Gravity affects us all. Yes.
And you know, let's talk about this surgery a little bit. I can tell she had the bags removed under the eyes.
Yes.
What's the downtime on an eyelid surgery?
There is some temporary bruising. The nice thing, Shelley, is that the recovery is actually quite rapid in the face, so about 5 days. Sutures are out by 5 days. I do my lower lids transconjunctival, which is a fancy word for the incision is made behind the eyelid, so it's thought to give perhaps a more natural appearance without a visible scar.
Okay, and we've got one more picture to show. This is someone who's had both the upper and the lower done.
Right.
That is several years. That is a huge, huge difference.
Yeah, very, very sweet lady. She looks angry, and it's the exact opposite. She's just the nice, very sweet lady. So we did the uppers and the lowers, and she's got gorgeous eyes, so now they're more visible.
What would you say to women or men who are in our audience this morning who are considering doing something but they don't know where to start?
If you want to dip your toe in the pool of cosmetics, then filler, Botox is certainly something less aggressive. At some point, there are some issues which can probably be better addressed with surgery. But it's good to come in for a consultation, get the facts, and then at least walk away with valuable information.
All right, it really is. Sit down. You don't have to do it the first time, but meet the
Definitely
surgeon, meet the staff, let them know what you're looking for, and address your concerns and get it taken care of. You'll feel better about yourself. You've got a special for our San Antonio Living viewers this morning. It's 1/3 off Botox for the first 20 callers, plus a complimentary consultation.
Yes.
No need to wait. Take care of it right now, all right? Ask about the San Antonio Living Special. Again, it's only for the first 20 callers. There's the phone number on your screen. It's 210-833-7972. Dr. Shah Plastic Surgery on Stone Oak Parkway. Find them on Facebook or check the website, drshahplasticsurgery.com. Don't go away. We've got more.